A village lying deep in the bushes characterized by bad roads and more bad roads. Sakpalua, as rhythmic as the name sounds, excruciating the poverty here. Over 1,000 people call here home, yet the conditions here are nothing to write home about. Politicians have erected so many power poles, but access to electricity remains a pipe dream. Mobile network connectivity is a no-go area. Open defecation is the only means of attending to the call of nature. Yet, this signage tells a different story. Sakpalua is replete with harrowing tales of residents being bitten by snakes as they dash into the bushes at night to defecate. Osman Bagaham is a resident and shares a personal experience.
Pam, ndamangwana jiang, ndambala lati, nchanta damro banjira, kang mahandle chenantinyu, dwakansa ndeyang ko.
The absence of a toilet is really a nightmare for us. Months ago at about 10 p.m., I was bitten by a snake while defecating in the bush. I almost died. It is a very pathetic situation.
Access to potable water is yet to be realized in Sakpalua. The search for water is a struggle for both the young and the old. Children especially spend hours in the unforgiving sun to obtain water for their families. The consumption of this often contaminated water exposes residents to the risk of contracting waterborne diseases. More troubling for inhabitants is the absence of a health center in this community. Those in need of critical medical attention have to be carried on motorbikes or tricycles on more than 2-hour bumpy ride to the northern regional capital, Tamale. Pregnant women are the most adversely affected by this healthcare inequality. 22-year-old Asana Abu is expecting her second child, but is often preoccupied with how delivery will pan out after the first childbirth nearly cost her life.
During my pregnancy, when I was in labor, it was horrifying. I was put on a motorbike while the labor pains were simply unbearable. I have been having sleepless nights about how delivery would be this time. We need a health center in the village.
I had terrible experience during labor. It took several hours to get to the closest hospital. Some women have died while going to give birth. It is very frightening.
This farming village has only 2 traditional birth attendants, but residents say patronizing their service is tantamount to gambling with one's life since the TBAs have no formal training. But there is a much bigger problem. The absence of a health center in Sakpalua means brisk business for itinerant quacks who supply drugs to inhabitants without knowing their exact health conditions. Mohammed Suleiman is one of such quacks. He says he learnt the job by observing attendants at pharmacies.
I learned this trade by observing the drugstore workers. I monitored how they speak to patrons and I listed names of some of the drugs. If it's headache, malaria or fever, I can give you medication. In fact, I can look at your face and tell what's wrong with you.
Villagers usually come out in their numbers to buy drugs, with Muhammad Suleiman carrying out diagnosis for malaria, typhoid, headache and bodily pains in less than a minute. Many of the residents have fallen for his pitch and often sing his praises.
He is our only savior because there is no health center here. Without him, it means we would have to travel for hours to Tamale to buy drugs. He is really helpful.
This job is really lucrative. I attend to 3 other villages apart from Sakpalua. I earn 200 cedis daily or even more depending on the number of patients.
2 million, 200 cedis.
Muhammad is highly respected and trusted in Sakpalua and other adjoining communities, never mind his trade being illegal and dangerous. In fact, many do not recognize he has no license or qualification for what he does. With deplorable roads, far-off health centers and a lack of connection between rural communities and medical institutions, these residents may trek for long hours to a hospital only to find out the medication they need is unavailable or they cannot get to see the doctor. Therefore, quacks like Muhammad will always come in handy despite the risks. If indeed Ghana is serious about leaving no one behind, then Sakpalua is a troubling food for thought. Redwan Karim Dini-Osman, GH1 News, Sakpalua, Savannah Region.